Ground. Please try to disregard it. It's very distracting, but you got to listen to what this lady says. Check this out.
Teenage death, and can you tell us if the teenager in question had underlying conditions?
I don't have that information at my disposal at this time. I know we have had people of all age groups die. I just want to be clear in terms of the definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. So that means that if you were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that if technically...
By the way, her statement, already been found to have COVID, only means you were found to have tested positive. You can test positive for it and not even have it, and I'm going to talk about that in a second, but listen to this lady's words.
Even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.
Yeah, Jessica, the doctors say that they have compiled their own data of coronavirus cases here in Kern County and used their research from the cases here to cross-reference them with numbers across the nation and really across the globe. They say that that data shows that healthy people don't need to shelter in place anymore. And of course, that's going against what a lot of health experts have been telling us so far.
I say, do we need to still shelter in place? Our answer is emphatically no. Do we need businesses to be shut down? Emphatically, no. Do we need to test them and get them back to work? Yes, we do.
Doctors Dan Erickson and Artin Masihi, both co-owners of the 5 accelerated urgent care facilities in Kern County, say they have tested 5,213 patients within the county for the coronavirus. That makes up for over half of all testing done here. They say their data and research qualifies their statement.
Is the flu less dangerous than COVID? Let's look at the death rates. No, it's not. They're similar in prevalence and in death rate. So we are saying that our response now that we know the facts, it's time to get back to work.
The White House Coronavirus Task Force expert Dr. Anthony Fauci says otherwise, with national research showing COVID-19 cases to be over 10 times as lethal than the flu. But Fauci's decades of experience as an immunologist and physician holds no weight in the eyes of Erickson and Masihi.
We're actually seeing the patients. Dr. Fauci hasn't seen a patient for 20 years.
White House health officials have reported more than 800,000 COVID-19 cases with just over 46,000 deaths across the nation. But Erickson says that quarantining is a health hazard in and of itself.
We understand microbiology, we understand immunology, and we want strong immune systems. I don't want to hide in my home, develop a weak immune system, and then come out and get disease.
Reporting the disease, Erickson claims, is being forced onto healthcare professionals.
ER doctors now, my friends that I talk to say, it's interesting, when I'm writing up my death report, I'm being pressured to add COVID. Why is that? Why are we being pressured to add COVID? To maybe increase the numbers and make it look a little bit worse than it is? I think so.
According to Erickson, there is something much larger at play here.
This is not about science, and it's not even about COVID. When they use the word safe, if you listen to the word safe, that's about controlling you. So when I talk to all my ER doctors who work in a hospital, no stake in the game, same opinion.
Here's what Governor Pritzker posted on Friday, moving into a weekend, okay? He said, moving on from our stay-at-home order toward a new normal will require 3 critical components, okay? It'll require testing, tracing, and treatment. And a little further down, he says, today I want to talk about contact tracing, which is one of the most critical tools we have to reduce our spread rate, speed up our diagnoses, and seek to halt outbreaks before they happen. Now let's start with the basics. What is contact tracing? And this is what I want you to pay close attention to. It's a system to make sure you get notified if you had contact with someone who is tested positive for COVID-19, so you can do what is necessary to keep you, your family, and your community safe. Now let's just unpack that piece for just a minute. So it's a system to make sure you get notified if you had contact with someone who is tested positive for COVID-19. Okay, so what does that mean? Right, that means they have to have a system to track you, track everywhere you go and every person you interact with. Okay, that's the first thing. If they're going to have a system to make sure you get notified if you had contact with someone who's tested positive for COVID-19, they have to have a way to track your every movement and every person you interact with. So that's what they're talking about doing. And they also have to know your medical information. So this means the government not only are they tracking every single person you come in contact with everywhere you go, but they also get to know what your medical records are. They get to know all of that private, sensitive information that we as doctors aren't allowed to share with anybody. If you were to come into my office at Cone Health Institute and we're working on you and you share with me some sensitive health information, or we do testing or something in our office and we find that you're sick or you're not well, I am not legally allowed to say a word to anybody about it. I can't even tell your family without you signing a document saying that I, the doctor, have permission to share that medical information with someone else. Definitely not the government, right? So what this is saying is it's a system to make sure that you get notified if you had contact with someone who's tested positive for COVID-19. That means they're going to track everywhere you go, every person you interact with, and have complete access to your medical information. So let go of who's saying this for a minute and just think about what that means. And imagine if, and let's say you like this governor, I want you to imagine for a minute that just think of the political leader right now who you can't stand the most, the person who you have the biggest worry about, the person who you would think of as the most tyrannical, most fascist, whatever your word is. Do you want them having this power? Do you want them to be able to track every movement you make, every single person you interact with, and have access to your medical information? Personally, I don't like that. And this is a program I would be very reluctant to participate in. Let's keep going. So he says, in order to move safely back toward normalcy, Illinois, the United States, and frankly, the whole world must contact trace on a never-before-seen scale. So we're talking about not just Illinois now. We're talking about statewide, nationwide, worldwide is what they're looking at, is how they're looking to implement this. So anywhere you go, worldwide, you would be tracked, and every interaction you had with other people would also be tracked. So to do that, Illinois will be building on our existing infrastructure and expertise to shape a massive statewide contact tracing operation, gradually building over the coming weeks and scaling up an army of contact tracers by the hundreds and then thousands. Let's say, thanks for the comment, Ben. But they're talking about an army of hundreds and thousands of people in Illinois alone whose job is to track you and trace you. Based on our current rates of spread, we're looking at a benchmark that could approach 30 workers per 100,000 residents. 30 workers per 100,000 residents. But to be clear, that number can and will diminish if we see greater success in our public health measures like our face covering requirement. Pay attention, guys. Pay attention to what this means. Okay, we're talking complete loss of privacy. They can track anywhere you go, every person you interact with, and have access to your medical information. And what they've said here is when someone tests positive for COVID-19, a contact tracer will reach out to them through an app, email, text, or phone call. And because not everybody can or will use this technology, some will require follow-up with a safe in-person visit. So we're talking government coming to your door. We're talking people actually coming to your home, okay? Hey, Benny, thanks for saying hello. So we're talking about the government actually coming to your home now, okay? So like I said, take these words away from JB, put them in any politician's mouth, okay? Because eventually JB is not going to be in office anymore. Either he's not going to be reelected or his term ends. Now someone else is in office. And do you want someone who's much more draconian, much more whatever, having this ability to track and trace every single person you interact with? It's a massive government overreach.